Turning now to medical marijuana, it has become a huge business in California. Advocates put the number at more than $1 billion a year.
And with so much money at stake, some pot doctors are being accused of cutting corners in order to cash in. And our Dan Noyes is here now with an I-Team investigation.
Well, Dan and Carolyn, we began looking into California's biggest pot doc, who has 19 offices up and down the state, after former employees told us he's bending and in some cases breaking the rules.
And you're not sleeping well, huh?
No.
Dr. Jean Talleyrand left behind his private practice in San Francisco's Mission District after he realized how much money he could make on medical marijuana. In less than 5 years, his Medican clinics have grossed at least $10 million.
Probably a little bit more than that. Yeah, so it's really blossomed.
Talleyrand doesn't sell pot himself. His patients have to go to a dispensary for that. But for $150, he provides the doctor's recommendation that clears them to smoke marijuana legally under Prop 215. The law's meant for seriously ill Californians with conditions such as cancer, AIDS, or glaucoma, but also any illness for which marijuana provides relief. That phrase gives Talleyrand and other doctors a huge loophole, one that doesn't exist in any other state's medical marijuana law.
Well, everything going okay with the marijuana?
Yeah, everything's going good.
As you can see on his own internal documents used for diagnosing patients, Dr. Talleyrand will recommend marijuana for anything from a headache to a restless leg, nightmares, psoriasis, diarrhea.
Marijuana tends to slow the gut down, and so you will have some easing of your diarrhea.
He'll even authorize marijuana for cannabis dependence if the patient smokes too much marijuana.
If you are overusing cannabis, you shouldn't go to jail for that. You should get proper treatment, and that's what we're here for.
That's the first I have ever heard of that. That doesn't make sense to me.
Dale Geringer was one of the original authors of Prop 215. He says Talleyrand and the other doctors on his staff have a reputation for not spending enough time to properly evaluate their patients. This schedule from a typical day at the Medican clinic in Concord shows 1 or 2 patients every 10 minutes for a single doctor.
I think 10 minutes. If I couldn't do a good job in 30 minutes, I don't know what people can do in 10 minutes.
Frank Lucido heads a group of medical marijuana doctors trying to set industry standards for quality care. He calls a 10-minute medical marijuana exam a fig leaf. It doesn't cover much.
And I think it's very serious because you're not only talking about somebody's health, but you're talking about their medical legal protection.
I get a hangnail and say, ow, it hurts. And you can get it.
Former Medican employees tell us patients rarely get turned down, no matter how flimsy their medical complaints. Talleyrand and his staff have racked up 130,000 clients, more than any other medical marijuana operation. Is it all about health, or is it about profits?
Profits. How could it be about health when you don't examine your patients? When you're just signing it off to give them a recommendation? It's a patient bill. It's in and out.
It would not surprise me that is happening. As I say, there's people who cheat on everything.
The guidelines from the state medical board are clear. Talleyrand has to consult with the patient's primary treating physician or obtain records to confirm the diagnosis and prior treatment history. At Medican, that often doesn't happen. Is there a company policy that you can give authorization for marijuana without medical records?
No.
In fact, Talleyrand's own guide for his 19 doctors says Medican will accept patients who have no medical records, and in that case, we must act responsibly in determining a diagnosis. The guide describes taking vital signs as a basic step. That's required by the state medical board for every exam. But we spent the day with Talleyrand at his office in Ukiah, and not once did we see him take vital signs.
Is he following normal standard processes when he is actually recommending these individuals for marijuana? So is he doing a history and physical on the individual? Is there a treatment plan?
The state medical board has questions about Talleyrand's practice and has launched an investigation after a complaint from a former Medican employee.
If we have, from some source, a concern that he is not providing the adequate care and treatment of his patients, we would definitely want to look into that matter to determine if he was following the standard of care.
Jean Talleyrand tells us his practice is different from mainstream doctors. Even before a patient walks in the door, whatever the ailment, he already knows the cure: marijuana.
I'm very comfortable with what I'm doing. I'm doing things within the law, and and patients are getting better.
Now, Talleyrand admits he authorizes marijuana for people in sensitive public safety positions who are not supposed to smoke pot even in their off hours. Police officers, firefighters, paramedics, even tugboat captains. Tonight at 11, authorizing marijuana for children and pregnant women. Talleyrand does it, and he'll explain why.
Wow. All right. We look forward to that report.
Yeah.
Thank you.